This once daily oral regimen in highly relapsed refractory patients with multiple prior lines of treatment led to very promising rates of marrow response. 23% of patients, or almost a quarter of the patients, achieved either a CR or a CRh. I would say about 33% of patients had an overall response, which also included MLFS and partial responses and CRIs. The drug was well tolerated. There was not a significant signal for QT prolongation, which was seen in other menin inhibitors. There was not much in terms of drug interaction. Approximately 13 to 15%, I want to say, of patients had grade 3 or higher differentiation syndrome, which is potentially a challenging class effect of menin inhibitors and sort of is a manifestation of the mechanism of the action of the drug, because it differentiates leukemic cells into normal cells, but sometimes that process of differentiation can be quite inflammatory and can cause a syndrome that can get patients quite sick. So about 13 to 15% of patients had differentiation syndrome, but the episodes of DS were managed effectively with standard measures, which mainly include steroids and cytoreduction as needed. The responses that were seen on study were pretty well preserved in patients who had prior transplant or prior exposure to venetoclax, which is very reassuring. I think overall the study did meet its primary endpoint in terms of the composite CR/CRh rate, and Ziftomenib currently has a PDUFA date in, I believe, November of this year, so we're hoping that it will become a potential option for patients with NPM1-mutated AML.